Hello, my name is Janet Drew. I'm currently a Master of Philosophy student at ANU and I'm a volunteer peer support worker. I am a person with MS. I've had MS for over 26 years now. I have the relapsing remitting form. I have three adult daughters and my working background is in IT services industry. I heard about Our Health in Our Hands project and the Grand Challenge competition through the Multiple Sclerosis Society here in Canberra, and there was a call up for people to go and support the presentation night. And anyway, I went along and it was very interesting listening to the project, and I thought this project offers real hope for people with MS. I was very interested in the use of technology for personalised medicine, and I really liked how they were looking to collaborate with people with lived experiences of MS. After they won the Grand Challenge, I saw an article from Jane Desborough calling for volunteers. She was looking for people to become involved with the project, and I thought, this is interesting. So I gave her a call and talked about my background and my interests, and she invited me to join the Health Experience Advisory Board. And it's a board that they were setting up to look after the interests of patients, family and carers, to make sure that their needs were looked at throughout the life of the project. And they really wanted diversity in the group, so people that could bring their different perspectives and expertise to the table. So I remember in the early days we were asked about what our hopes were for the board, and I guess I had three points I think we had to come up with, and the first one I had was that the interests of people with MS and people with diabetes 1, the other disease that they were focusing on, was number one priority. I wanted that we were to be taken seriously, and I also wanted to see us really collaborate because I thought there was a lot we could learn from each other. So together we worked on the terms of reference, and from a personal perspective I found it very empowering to have a say in how a board such as this, its role, how it was set up and how it would be positioned within the structure of the project. To be honest, I was thinking if we get this right, this board could be used as a template for future projects. And I guess from participating in this board then generated an interest in me to maybe get involved in more in the research side of things, which, to cut a long story short, I moved on to become the Master of Philosophy student, and at that stage I had to resign from the board to avoid conflict of interest. I started my Masters in Philosophy in April this year, and for my project I'm going to look into the experiences of people with MS with respect to navigating care. I believe my project for an MPhil will probably be a pilot of the protocols, and depending on the outcome of those, we could expand the project and go out to a wider group, and that would form part of a PhD. Since I became a student with the Research School of Population Health, I'm now involved directly with the research team for Ohio, Our Health in Our Hands, and we're more specifically doing work with qualitative research and reviewing transcripts from focus groups. I also provide volunteer peer support with MS Connect, which is a program offered by Multiple Sclerosis Limited, a charity. The program was developed because people living with MS requested that they could speak with other people who understand what they were going through. Depending on the training you receive, there's a process involved. You need to apply for starters, and if you are accepted into the program you need to undergo specialised training, but you can choose to participate in one-on-one calls, or you could do facilitated training of groups, and they can be face-to-face groups or telephone groups using telephone conferencing technology. I find peer support volunteering very rewarding. I've learned new skills and it has helped my confidence in my abilities, which is something that people with MS often question. And it's really helped my understanding of the impact of symptoms and the issues that people with MS experience. I really hope that with the knowledge and experience I've gained from working with other people with MS, that I can make a difference, I guess, and my involvement with people with MS will be beneficial in the research activities that I undertake and myself personally, and also the other research that I'm participating in. And from a bigger picture, I'm really excited to see what Ohio finds. I'm really hoping that the outcomes will make a real difference to the lives of people with MS and how they manage their disease.